I'm Dr. Grace Levy-Clarke, and I'm presenting hypertension treatment for the Health Ministries Department at the Town and Country SDA Church. So we're going to continue with some different types of antihypertensive drugs. And one category that's not used as much are what we call alpha agonists, and the classic one is clonidine. What is the mechanism of action? So clonidine is usually used when they've gone through, a few other classes and you're still having fairly high blood pressure, so they'll add it on. It's going to decrease your heart rate, and it's going to do some of what the other medication do, so it's going to add on to the relaxation of the vessels and just allowing a better flow of blood through the vessels. So when you take clonidine, it's going to decrease the heart rate, relax the blood vessels, the blood is going to flow through the vessels better. And so what you're going to end up with is some of the same side effects, but they might be a little bit more pronounced. So this tiredness, dizziness, sleepiness, and headache. But I think the most important thing when you think about why you're on your blood pressure medicine, it's going to go back to what we talked about in the first section. Remember, we're trying to prevent stroke. We're trying to prevent kidney disease. We're trying to prevent blindness. So if for some reason they're still having more difficulty improving your blood pressure, they usually have to add on the clonidine. One of the other drugs that you might find are the beta blockers, and metoprolol is a classic example of that. And basically, the beta blockers, they're going to cause the heart to beat slower. That's sort of the classic way that they work. And by beating less vigorously, it's going to decrease the force of the blood passing through the vessels. So it's going to lower your blood pressure and basically just reduce the strain on the heart. For these medications, the side effects are going to be directly linked to the mode of action. So these are medications that they typically won't give you if you have asthma or if you have any kind of heart arrhythmia, because it's definitely going to slow the pace of your heart. So some people will develop some shortness of breath, feeling again fatigue and dizziness. So I think you can tell from just much of what we've talked about that in order for these blood pressure medicines to work, they really have to alter the way your heart, your cardiovascular system is working. The angiotensin converting enzymes are very popular, lisinopril, and they especially like to give it to patients who already have either some damage to the kidney or potential damage. So if you're, diabetic, it blocks a specific substance that causes the blood vessels to constrict or tighten. So it's going to relax your blood vessels. And the side effects, quite unusual, is you can, for some reason, develop a dry cough. And a lot of people are just unable to tolerate it, and so they'll come off of it. But lisinopril, the angiotensin-converting enzymes, they are supposed to be just good as a protective medication if you are at risk to develop any sort of kidney type damage. So I just wanted to end by saying we've really spent some time talking about the heart, and it's important for you to remember that you have to love your heart. You have to take care of it. And one of the easiest things you can do is just take a short walk every day. And we're talking 10 minutes. Do some muscle building exercise. And you can start with as low as a 2-pound weight. Just, build up your muscles. And even if you're eating fruits and vegetables right now, just add one more fruit or one more vegetable to what you're doing now. And remember to make breakfast a healthy start. So try to think about your heart, and for that, you want to go with your oatmeal. And I think this is probably the hardest one to start, but the easiest one to maintain. Believe it or not. Just stop drinking anything that has added sugar. And they have a lot of good juices now that have no added sugar. So you're going to have to pull out your glasses, take it to the Publix with you. You're going to have to read those little labels. Anything that says added sugar in your drink, eliminate those. And you're going to find that that's going to do a lot for your heart. And then eat some nuts. And almonds are great. And every time you go out to eat and you're tempted to order steak, just go to the section on the menu that says fish and pick one of those. And then the one thing you want to do is just find ways to relax, because that's just a great way to get your blood pressure down. Nothing like just sitting outside, whether it's in your backyard or in the park, and do nothing for a while, but just sit there. There's nothing like a good 30 minutes of relaxation. And I have to say, it probably will mean turning off the TV, because nothing on there is relaxing. So it's great to have at least 1 or 2 or 3 rooms in your house with no TV. And, don't be tempted to put one up on the porch. Just go somewhere where you have nothing to do but get a nice rocking chair and just sit down. 30 minutes, 20 minutes, or even just 10 minutes, and just do nothing. And then why do I say sanitize? So use your hand sanitizers. Why? Every time you're sick and you have to fight an infection, your heart has to work. You notice you get a fever every time you have a bad infection? So what you want to do is try to keep as healthy as you can. And remember, love your heart, because it's going to love you right back. Thank you.